inhalers being addictive is something that most parents are very, they're often talking about it and quite wary of the whole, thing becoming addictive. So please tell us if inhalers are addictive and if they should be used in children at all.
So I think there is no parent who's not asked me this question.
I'm sure.
So I think this whole norm stems from movie knowledge.
Movies.
Okay,
Absolutely,
this is
you're
just
right.
from the movies, which is very, very far from the truth.
Uh-huh.
Okay, so this is a whole it's a myth that inhalers are addictive. They're not at all addictive. They do not contain anything that's addictive. Okay, it's just a simple medicine. So again, it's just coming from the false norms, watching a lot of movies or listening to our elders maybe,
Right.
who don't know the facts for right. So inhalers are very safe, like I said, just very less dosage. They're not at all addictive. The moment the problem stops, we stop the inhaler.
Correct.
Whenever we see the resolution of symptoms, we comfortably stop the inhaler and it goes all right. So there are no addictive concept at all.
Okay, that makes me want to ask you another question about asthma, whether it's actually curable or not. Because the other thing that I've heard, and I've often seen this, that the moment you see a child with an inhaler or even an adult with an inhaler, you'll end up using that medication for life. So please help clear this confusion for me, whether asthma is curable at all and whether the medications need to be taken for life.
That's a good question. See, inhalers are not for lifelong.
Okay.
No medicine is for lifelong when it comes to asthma. So, yes, asthma is a very chronic condition and we usually manage it over time. But it's not that asthma is not curable anymore. Asthma is curable. We have different therapies for that available right now. But yes, so usually if you ask me, we see some children outgrow these things. Okay, how do they outgrow? So like I was talking to you about before, so the most common triggers in children are viral infections.
Okay.
Once they have fewer viral infections or once they grow in age, once their exposure to viral infections are less, so thereby the triggers are less. So that's why probably they will outgrow of this entity.
Okay.
And also, recognizing it early, using the right medication, keeping it well controlled is what is important. And anyway, the goal for us is to give minimal or no medicine and make sure the child is symptom free, does day-to-day activities normally, and even does strenuous physical activities and also participate in sports and everything. So it's like you have it, you're not taking anything for it. So
Understood.
that is what is our ultimate goal when it comes to these children.